talk more about the harms of sugar and what it does to your oral microbiome. But let's introduce the oral microbiome. In the mouth alone, there's about 700 to 800 species made up of bacteria, fungi, viruses, and protozoa. And these bacteria can colonize hard surfaces of the teeth and the soft tissue, so on the upper part of your mouth, your cheek, your tongue, and they're all sending chemical messages. They all have DNA, and they can turn genes on and off. So some stats here. Over 42% of the population over 30 suffers from some type of periodontal disease or gingivitis. What's the difference? So gingivitis is the beginning of inflammation. So you might find maybe some bleeding gums. It's just the start of it. But by the time you get to periodontal disease, that's now gum disease that has gone full force. So now you're at risk of possibly losing your teeth. So gingivitis is the first step, and then you don't want to get to periodontal disease. So this is seen even in people who take excellent care of their teeth. And I'm sure you've heard of people who are like always going to the dentist and they're just always struggling with their mouth, and then other people, they like never do anything and they're perfect. So, you know, there's always that. So this occurs, so these periodontal disease and gingivitis can occur to dysbiosis in the mouth. And dysbiosis would be when there's more bad bacteria than good bacteria, or there could be some pathogens that are starting to take hold. And the longer it goes on, the more likely you can create biofilms, which is basically sort of like a layer that covers over your tooth or your gums. And that is very difficult for the immune system to recognize and fight it. So by the time you have biofilm, you really do need some expert help to get rid of the biofilm, because just brushing your teeth and all of that is not going to help. How this impacts the rest of our bodies is it causes immune dysregulation, because in fact the good bacteria is what is helping our immune system. It also causes pathogen translocation. So literally there are pathogens in your mouth that can go into your heart, into your colon. And the most exciting part of research right now is that they're finding these pathogens in plaque and in colon cancer tumors that are supposed to be in the mouth. Obviously, this will cause inflammation, and we know inflammation is a really underlying cause of a lot of systemic diseases like heart disease, cancer, arthritis, even COPD, dementia, IBD. I mean, you name it, it's linked to a bacteria. All roads lead to the microbiome, wherever it is, in the gut, in the mouth. And so how do you know you might have dysbiosis of the oral microbiome? Well, you might be developing kink or sores. You might have bad breath. You might even find yourself having a lot of respiratory ailments, because again, there's even a lung microbiome. Tonsillitis, so sometimes you see kids having a lot of tonsillitis and they take out their tonsils when really we should probably impact the oral microbiome. An excess creation of cavities. And so one of the things to think about is when you're swallowing, that also is going down to the microbiome and impacting the microbiome. The gut microbiome impacts the rest of our body, so it's almost like a synergistic spiral. So some of the major causes of plaque and cavities, so when we have dysbiosis, it will cause plaque and cavities. And interesting, one of the major hits to the gut microbiome as well as the oral microbiome is stress. And so who is not stressed? But when we're stressed, we release a hormone called cortisol, and this will increase acid production in the mouth and cause that plaque and inflammation in the mouth. So that's how you could be doing everything perfect, but if you don't manage your stress, that does have a lot of independent impact on our mouth and on our gut. So on our gut itself, we know that people who have chronic stress, no matter what they do, if they don't get the stress under control, that's going to leave a leaky gut, which is a massive root cause of inflammation. You might have environmental changes. So in a minute, we're going to talk about the pH of the mouth, and you can have a basic, you can have normal or a very acidic mouth, and you never want to be in the extremes. So sometimes if you get any of the extremes, so it actually should be raised or lowered, that's considered something that might promote the plaque and cavities, bleeding gums. And sometimes people develop this sticky fluid in the mouth, which also leads to, that's usually a function of like people who have excessive dry mouth. Sometimes medications cause this, sometimes hormones cause this, but that is not a good thing to have in your mouth. And then the ecological shifts that we do have control over. So we can grow pathogenic bacteria in our gut and in our mouth because of our lifestyle and our diet. And so the diet really, really affects what's happening in the mouth. Sugar, for example, sugar and starchy foods are notorious for upsetting this balance because once we have that, the bacteria feast on this and then basically throw up acid, and that acid starts breaking down the carbohydrate, the sugar, and then it forms the plaque. So that, once again, you know, we know it's not good for us, but now we have another mechanism of how it's disrupting our mouth. And then when you have gingivitis and periodontal disease, obviously they themselves will cause the plaque. And then there are other things like hormonal changes. So, you know, when you're pregnant or when you're going through menopause, those areas of life can also cause disruption. And then some people take different kinds of medications, which also can cause disruption. So when the mouth goes rogue, these are just some statistics of how the pathogenic bacteria can cause systemic impact. People with severe gum disease have 3 times higher risk of stroke. People over 70 have 70% higher risk of developing Alzheimer's when they have gum disease. People with gum disease are twice as likely to develop heart disease, and one of the bacteria, the Streptococcus mutans, which we find in the mouth, is oftentimes found in the plaque. Rheumatoid arthritis patients have 8 times more likely risk to have gum disease. Fusobacteria nucleatum is one of the most recent one that they've discovered. They used to think that it's in the gut, and actually it resides in the mouth. However, they have found it in colon cancer tumors. So that's an example of how the bacteria can translocate. And then periodontitis strongly is associated with irritable bowel disorders. So the body never works in isolation, it's always communicating. So the good news is most of the bacteria in the mouth is actually good. It can regulate and control the bad bacteria. It can boost the oral immune system, so it does act as a barrier. So the more of the good bacteria you have, the better it is to protect you. It can strengthen that epithelial barrier, especially down the GI tract. It makes vitamins in the gut. So for example, it makes B vitamins, it makes vitamin K2, and vitamin K2 is a really interesting nutrient because it helps shuttle, basically if you have calcium, instead of letting it sit around in the arteries and harden, it can allow it to go into the bones where it needs to be. Produces anti-inflammatory substances, reduces infections. The difference, like for example, not even foodborne illness, but even any kind of infection, but let's say you're in a restaurant, and this is more gut microbiome related also, but the difference between you and a friend sitting at a restaurant where the food is contaminated is that if your microbiome is good, you might have a little diarrhea or you might feel not well, but by the next day you're fine. Whereas that other person can end up in the hospital if their microbiome is disrupted. So it's like it's an armor. And most importantly, and where we're going with this, is that the bacteria in the mouth, there's several strains that actually are making the enzyme nitric oxide synthase, which Lexi so eloquently talked about, and that is helping make that nitric oxide. When you're breaking down food, it turns the nitrate into the nitric oxide. So I know this is really small, but I'll talk you through it. So let's say, how does all of this happen? So let's say you're eating beets or you're eating your greens in your salad. That's basically eating that rich nitrate food. And then what happens, it goes through the digestion and absorption process and eventually will leak out the nitrates, and those nitrates will absorb into the blood. About 25% of that circulating nitrate is taken up into our salivary glands, and we have saliva that produces that nitric oxide basically through the work of the bacteria, which now is breaking down more of that nitrate, which now you're swallowing, so it's like going back into the stomach, but then a whole bunch of it sits around in the blood as a reserve. So that when you need it, like for example, when you're exercising, it's there. So you're probably thinking, but I'm not eating the nitrate-rich foods. What happens? Well, your body's very intelligent because it has a backup plan. And so the backup plan is when it's sensing that there's low oxygen. So for example, in a state of cardiovascular disease, or you're working really hard and you're starting to lower that, like you're delivering oxygen, but you're also depleting oxygen the longer you work out. Now the nitrate is reduced to the nitric oxide by other enzymes in the body, and some of them are coming from the mitochondria. The other pathway is that your body normally produces nitric oxide all the time. And some people are more robust than others because we have those NOS enzymes, as Lexi said. So we have some in the blood vessels, eNOS. We have those nNOS from the brain, as she talked about. We also have an iNOS, which are in other tissues and other cells and all the lungs. So your body is going to protect you, but when you're actually exercising, this just makes the whole process a lot more efficient in producing that nitric oxide. So there's a plug for exercising. Now, we talked about some of the supplements, and where the research is going is, even though the arginine is a direct producer of nitric oxide, sometimes we see that when you have those genetics where there's that polymorphism, the arginine may not be as efficient as the citrulline. So it's like the citrulline makes the arginine makes the nitric oxide, and for some reason, for some people, the citrulline sometimes works better. So that's just something that we're still working through, and we don't truly have an understanding of everything. But one of the things you might have heard in the news, because it's gotten a little bit of press time, is that certain types of exercises, basically anything that uses really large muscles, can trigger also just the release of nitric oxide. So squats are really good. Squats are getting a lot of headline in the news lately for losing weight and everything. But basically, you can even march in place, or, just do your arms like this for, 48 times or whatever, but all of that can help start generating nitric oxide. So how do you know that you might not be producing enough nitric oxide? So we talked about how it impacts blood pressure. The nitric oxide expands the blood vessels, so your blood pressure will be lower if you don't have enough of it. you'll start increasing your hypertension risk. Poor metabolic and gut health, reduced exercise tolerance, so maybe you find that you can't do things as long or as efficiently as you did when you were younger, cognitive decline, brain fog, even sexual dysfunction, aging, impaired immune function, inflammation, and impaired wound healing. So all of these things are basically, we see these happen as you get older, but we don't have to have it happen if we know how to take care of it. So the oral microbiome test is something you can purchase, and this is a newer development in the market of the microbiome. And basically, when you get your kit, if you order this, you have this swab and you circulate it around your mouth on each cheek for about a minute. You send it back to the company, and the company will come back with results of what is sitting in your mouth. So I have some results of 2 different people. And the first thing on that test is the pH of the mouth. So you really want the pH of the mouth to be in the green part, which would be somewhere around 6.7 to 7.3. Now, on the top, you have a person's oral microbiome that has a very low pH, so that means a very acidic microbiome. And that would basically mean you have a risk of dental decay. This is probably a function of too much sugar, maybe poor oral hygiene, or maybe not drinking enough. But then we have another person who had a very basic mouth. So that could have been chronic gingivitis, adrenal disease, and adrenal disease is basically one of burnout, or possibly a high intake of alcohol. So this is the person with the low pH, and this is kind of what you get. And at the end of the report, it'll tell you if you're triggered for something that's abnormal, it'll tell you what is it linked with. So in this particular situation, you see that the very first one, Campylobacter rectus, is really quite high. So as you could see, there's like opportunistic bacteria and pathogenic bacteria. The opportunistic bacteria, they're just bacteria that are there in low amounts. They could even be doing some benefit. But once they start overgrowing, they become more dangerous. We never want to see any of the pathogenic bacteria because that's a little bit more risky. Fungi, that's also an overload if it's too high. And then we look at what is the normal oral flora doing. And of course, these are snapshots. So in this person, you see Campylobacter rectus is very high. And that would probably mean that that person potentially has periodontitis, but we also see this particular bacteria in cardiovascular disease. There could be poor pregnancy outcomes if this person gets pregnant, and could be linked with an organ abscess. When you go down, there's another one kind of overgrowing, but it's not, this one would mean the same thing. It could be linked with rheumatoid arthritis. And so there are other, like gut bacteria also, that when we see certain kinds of strains, we're like, okay, this person might be at risk for rheumatoid arthritis. So the mouth and the gut work together in that way. And then they do have one pathogen, so that one would be very concerning, because what that would mean is if, let's say, they get some kind of respiratory virus that could put them over into possibly like pneumonia, that could be very risky. Here, they don't have any fungus overgrowth, so that's really good. And then when you look at the normal flora, this would mean there is a microbiome imbalance. So the Streptococcus salivarius is a good bacteria. Salivarius is oftentimes found in better mental health, for example, and these are too low. The lactobacillus is too low. So that would mean that this person could potentially be at risk for dental disease if they don't do something now. I mean, they may not have it right now, but these are warning markers. We've got to do something about this now. Now this is the person that had the high pH, and once again you see a high Campylobacter rectus, and then there's also the gingivalis, so perhaps the immune system is compromised. So those are two markers I would really look at, but there's no pathogens, no fungi, so that's really, really good. But as you can see, the normal flora is also low. So that would be something we would want to take care of. So let's say you get a report like this and you're kind of nervous. I have a student who wants to do some work on the oral microbiome, and she said her dentist said no one should ever eat any fruit ever. And I don't know if I would go that far, but let's talk about, you know, some more realistic things. So the number one thing is eat nitrate-rich foods. Again, they're not going to cause acid. They're actually going to be beneficial for your oral microbiome, for your gut microbiome, for your blood vessels. So if you don't like the beets, then the salads like arugula, spinach are real powerhouses, and celery. You want to limit. I can't say no, do it, because we're human beings, we're going to do it. We're going to eat sugar, but you want to limit as much as possible the sugar, the soda. The bread actually causes it because it's starchy. The pasta will cause it because it's starchy. Artificial sweeteners. The only artificial sweetener that is good for your mouth is actually xylitol. Simple carbohydrate. Coffee doesn't upset the microbiome, but it could break down the enamel. So the first thing you're probably thinking is the same thing I thought. Oh, well, now if I'm ever going to have dessert, I'm going to run and brush my teeth. You don't want to do that, because what's happening right now is you're breaking down and that acid is coming out. If you start brushing immediately after you eat that kind of food, what you're doing is you've already exposed the acid, and now you're more likely to break down your enamel if you're brushing it. So you'd want to wait a little bit. You could chew that sugar-free gum with the xylitol, or you could balance those acidic ingredients and, for example, maybe have something in that meal with some of these foods. So I think the easiest one to implement is maybe have a little bit of cheese, or maybe in that meal you could have corn. Maybe you want to swish around with coconut oil. You know, sometimes you hear about oil pulling, fish. All of these would be more balanced ones. And then you want to drink lots of water, because poor hydration will promote some of those pathogenic overgrowths. And of course, eat the fermented foods, or take a probiotic to help with that. You might be surprised when I tell you the number one thing you want to really take care of is not to use mouthwash. How many people think using mouthwash is great? So what happens is when you use mouthwash, it does kill the bad bacteria, but it also kills the good bacteria. The good bacteria making that nitric oxide synthase. And so there are numerous studies now that show people who use mouthwash regularly, and it doesn't matter if it's like Listerine or something that your dentist gives you that's stronger, that might be even worse. What that's going to do is break down the ability to make that nitric oxide, and we actually have the studies that show people who use mouthwash regularly have higher blood pressure than people who don't. So the best thing you can do for your mouth is use a tongue scraper. That actually has a lot of benefit, and it only costs like, what, $2? So get in the habit of that. And many of us do have good oral care, and we still have these issues, but what would be good oral care? Well, you want to floss daily. You want to basically brush your teeth twice a day at least. So we brush our teeth. Do we floss daily? We hope that you visit the dentist at least twice a year, because that's where they can scrape off some of that plaque and see what's happening. But what a lot of people don't know is that a water irrigator can be extremely helpful as well. So that just will get other deep, things out of the pockets that maybe the picks can't get. A diet rich in whole foods such as vegetables, vitamin C. So a lot of the times when you see bleeding gums, sometimes that's also a sign of low vitamin C. But the foods like calcium, the phosphorus from the vegetables, not the soda. So that will always keep the balance, and it's always a good thing. And then they have found that certain strains of probiotics from L. reuteri, there are certain particular strains that have been tested, can also help. And L. reuteri is becoming a real star in the microbiome and now in the oral microbiome. But you have to use those strains. And then who has heard of oil pulling? Okay, so you've probably heard, oh, that's just like blackboard science, but actually coconut oil can kill fungi without any side effects. So you don't have to do it every day, but if you put a little bit of coconut oil in a little bit of water and swish, and they say for 20 minutes, that's a little excessive. But if you just do that, you know, every now and then, that is one way that can help rebalance some of the bacteria in your mouth. It can help, so the studies show it can help prevent plaque and preserve your gums. However, once the process has started, it might be less effective at that point. And then you could talk to Dr. Mitchell, because there are special toothpastes that can clear the biofilms, clear the plaque, and you wouldn't use it forever. You would use it for a short time until you get things rebalanced, and then you can go back to your regular oral care and really focusing on that diet. So that concludes our presentation, and so we hope you enjoyed it, and we're open for questions.